Chapter 13, Respiratory System. Let's discuss the structures and functions of the respiratory system. Let's explore the organs of the respiratory system, how air flows through it, and the key components of respiration. First, use the figure to identify the key organs in the respiratory system. We have the nasal cavity, pharynx, larynx, trachea, bronchi, and lungs, with alveoli as the site of gas exchange. Each structure works together to ensure the body gets the oxygen it needs and expels carbon dioxide. Now, let's trace the flow of air step by step. Air enters through the nasal cavity or mouth. It passes through the pharynx and larynx. From there, it moves into the trachea. Air then enters the bronchi, which branch into smaller bronchioles. Finally, it reaches the alveoli, where oxygen and carbon dioxide are exchanged. The respiratory system is responsible for several critical functions that keep our bodies working properly. Let's explore these functions in detail. One of the primary roles of the respiratory system is the exchange of gases. Oxygen from inhaled air is delivered to cells, enabling energy production. Carbon dioxide, a waste product from cells, is exhaled. This exchange of gases is essential for maintaining life. Did you know that the respiratory system also helps regulate blood pH? By adjusting the levels of carbon dioxide, the body can maintain a healthy pH balance. Too much or too little carbon dioxide can disrupt this balance. The respiratory system protects against foreign particles and microorganisms. The nasal cavity filters air, while mucus and cilia trap harmful particles. This protective barrier is crucial for preventing infections. The movement of air across the vocal cords produces sound. This is how we speak, sing, and communicate using our voices. The respiratory system is also responsible for our sense of smell. Olfactory receptors are located in the nasal cavity, allowing us to detect and identify scents. Many medical terms come directly from Greek or Latin roots. Learning their original meanings can help you better understand and remember their medical definitions. Alveolus, derived from Latin, meaning hollow sac, refers to the small air sacs in the lungs where gas exchange occurs. Bronchus, from Greek, meaning windpipe, the large airways that lead from the trachea into the lungs. Cilium, Latin for eyelash, refers to the tiny, hair-like structures that line the respiratory tract and help move mucus. Sputum, from Latin, meaning to spit, the mucus or phlegm that is expelled from the respiratory tract. Trachea, Greek for windpipe, the tube that connects the larynx to the bronchi, allowing air to flow into the lungs. Let's discuss the upper respiratory tract. The nasal cavity is a vital part of the respiratory system, playing key roles in breathing, protection, and even voice resonance. Let's explore its structures and functions. The nares are the openings of the nose, commonly called nostrils. They allow air to enter the respiratory system. The septum divides the nose into left and right compartments. This structure is essential for airflow balance. The conchae, located on the lateral walls of the nose, are bony ridges. They increase the surface area to help warm, moisten, and filter the air. The meatus is a passageway, or the external opening of a passage in the nose. The mucosa lines the nasal cavity and secretes mucus. This mucus traps dust, pollutants, and microorganisms, protecting the respiratory tract. The sinuses are hollow structures that open into the nasal cavity. They reduce the weight of the skull and act as resonating chambers, giving depth and richness to the sound of your voice. The nose plays a critical role in the respiratory system, serving as the first line of defense and preparing the air for the lungs. Let's take a closer look at its functions. Air enters through the nares, or nostrils, and the palate ensures that inhaled air does not enter the mouth. The hairs in the nose trap large particles, preventing them from reaching the delicate respiratory passages. As air passes through the nasal cavity, mucus moisturizes it, making it less harsh on the lungs. The blood vessels in the mucous membrane warm the air, protecting the lower respiratory passages from potential damage caused by cold air. The olfactory receptors, located in the nasal cavity, are responsible for your sense of smell, allowing you to detect and identify different odors. The pharynx is a critical structure in the respiratory and digestive systems, serving as a shared passageway for air, food, and drink. Let's explore its three parts and their locations. The nasopharynx is located posterior to the nasal cavity. It serves as the uppermost part of the pharynx and is responsible for the passage of air only. The oropharynx is located posterior to the oral cavity. This middle section allows for the passage of both air and ingested materials, like food and drink. The laryngopharynx is located posterior to the larynx. It's the lowermost part of the pharynx, directing air into the respiratory tract and food into the esophagus. The oropharynx is not just a passageway for air, food, and drink. It also contains important structures that play roles in immunity and swallowing. Let's explore these features. The tonsils are masses of lymphatic tissue located within the oropharynx. They play a crucial role in the immune system, helping to fight infections by trapping bacteria and viruses entering through the mouth or nose. The uvula is an extension of the soft palate. It helps close off the nasopharynx during swallowing, preventing food or liquid from entering the nasal cavity. Let's use the figure to locate these structures. Can you point out where the tonsils are situated in the oropharynx? Great. They're positioned on either side of the throat. And what about the uvula? Can you describe its location and role? Exactly. It hangs from the soft palate and assists during swallowing. In medical terminology, it's important to know how to change root nouns into their adjective forms. This helps describe specific locations or conditions more precisely. Let's explore how to do this with terms related to the pharynx. To describe something related to the nasopharynx, we change the noun into an adjective by removing the x and adding geal. For example, nasopharynx becomes nasopharyngeal. The same process applies to the oropharynx. Remove the x and add geal to form oropharyngeal. Lastly, the term pharynx becomes pharyngeal using the same rule. Medical terminology often comes with unique spelling rules that are essential to master. Let's focus on some examples to help you learn these differences. The structure itself is called a tonsil. However, the procedure to remove it is spelled tonsillectomy, with an added ectomy to indicate removal. The single bony projection in the nasal cavity is called a concha. The plural form, referring to multiple projections, is spelled conchi, pronounced conchi. A single opening in the nose is a nares, but both nostrils together are called nares, pronounced nares. The larynx, commonly referred to as the voice box, plays a crucial role in both respiration and sound production. Let's break down its key structures and their functions. The epiglottis is a spoon-shaped flap of cartilage that plays an essential role during swallowing. It covers the glottis to prevent food or liquid from entering the airway. The glottis is the opening of the larynx that connects to the oropharynx. This is the passage through which air flows into the respiratory tract. The thyroid cartilage forms the prominent structure known as the Adam's apple, visible in the neck. The cricoid cartilage serves as a connection between the larynx and the trachea, providing structural support. The true vocal cords are responsible for sound production. They vibrate as air passes through, creating the sounds we use for speech. The larynx serves multiple important functions in the respiratory system, beyond just being a passageway for air. It also plays a central role in voice production and communication. Let's dive into its key features and functions. The larynx acts as a passageway for inhaled and exhaled air, ensuring smooth airflow into and out of the lungs. The epiglottis prevents food and drink from entering the airway during swallowing, keeping the respiratory tract clear. When air is forced through the true vocal cords, they vibrate to produce the sounds we recognize as the voice. These sounds are then shaped into words by the pharynx, tongue, teeth, and lips. Have you ever wondered why men and women have different voice pitches? It's all about the size and thickness of the vocal cords. In males, The vocal cords are longer and thicker, which produces lower-pitched sounds. In females, the vocal cords are shorter and thinner, leading to higher-pitched sounds. Let's discuss the lower respiratory tract. The lower respiratory tract contains the structures responsible for conducting air and facilitating gas exchange. Let's explore its key components and their roles in respiration. The trachea is a flexible tube supported by C-shaped cartilage rings, which maintain its structure while allowing flexibility. It conducts air to the bronchi and is lined with cilia and goblet cells to filter out particles and humidify incoming air. The lungs are spongy organs divided into lobes, 3 in the right lung and 2 in the left. They're covered by a membrane called the pleura, which reduces friction during breathing. The tracheobronchial tree includes the primary, secondary, and tertiary bronchi, which distribute air to all lung regions. As the bronchi branch into smaller airways, the amount of cartilage decreases. The bronchioles are small airways without cartilage, controlled by smooth muscle. These mark the transition between the conducting zone, or terminal bronchioles, and the respiratory zone, or respiratory bronchioles. The alveoli are tiny air sacs located at the ends of the bronchioles. They are surrounded by capillaries to enable efficient gas exchange. Type I cells facilitate the exchange of oxygen and carbon dioxide, while type II cells produce surfactant, which prevents alveolar collapse. The trachea is commonly known as the windpipe and serves as a key part of the respiratory system. The trachea is a rigid tube surrounded by 16-20 C-shaped cartilage rings, which prevent collapse while allowing flexibility for nearby structures like the esophagus. The trachea acts as a passageway for air, conducting inhaled air from the larynx to the main bronchi and exhaled air in the opposite direction. There are 2 soft, spongy, conical lungs located in the thoracic cavity on either side of the heart. The right lung has 3 lobes, superior, middle, and inferior, while the left lung has 2 lobes, superior and inferior, to accommodate the heart. This concise explanation provides essential details about the trachea and lungs, reinforcing anatomical structure and function. The lower respiratory tract plays a vital role in one of the most essential functions of the body: gas transport. Let's explore how oxygen and carbon dioxide are exchanged and transported through this system. The lower respiratory tract is responsible for transporting oxygen from inhaled air into the blood capillaries. This ensures that oxygen reaches every cell in the body to support vital functions. At the same time, it removes carbon dioxide from the blood capillaries, allowing it to be exhaled, which helps maintain proper blood pH levels. Gas exchange takes place in the alveoli, small air sacs in the lungs. Here, oxygen diffuses from the alveoli into the surrounding capillaries, entering the bloodstream to be delivered throughout the body. Simultaneously, carbon dioxide diffuses from the blood into the alveoli, where it is expelled from the body during exhalation. Let's take a closer look at the lungs and the key structures that surround and support them in the thoracic cavity. Understanding these relationships is essential for grasping how the respiratory system functions. The base of each lung rests on the diaphragm, a dome-shaped muscle that plays a major role in breathing. The diaphragm divides the thoracic cavity, or chest, from the abdominal cavity, or belly. The mediastinum is the median partition of the thoracic cavity, located between the 2 lungs. It contains vital structures, including the heart, making it a central region of the chest. A fissure is a deep furrow or cleft. In the lungs, fissures divide the lobes, helping separate and define their structure. Some medical terms are general in nature, meaning they're used across multiple body systems. Understanding these terms will help us better describe structures and functions within the respiratory system and beyond. Let's define a few key terms. A fissure is a split, furrow, or cleft. In the lungs, fissures separate the lobes, helping to define their boundaries. The hilum is the site where vessels and nerves enter and leave an organ. In the lungs, the hilum is located on the medial aspect and serves as the gateway for blood vessels and bronchi. A lobe is a subdivision of an organ or part. Each lung is divided into lobes, 3 in the right lung and 2 in the left. The parenchyma consists of the functional cells of a gland or organ. In the lungs, the parenchyma is directly responsible for the process of breathing. The stroma is the connective tissue framework that supports the parenchyma. In the lungs, the stroma is composed mainly of elastic tissue, which helps maintain lung structure. The pleurae and pleural cavity are essential structures that protect and facilitate the function of the lungs. Let's break them down. The visceral pleura is the membrane that directly covers the lungs, providing protection and helping them move smoothly during breathing. The parietal pleura lines the inside of the thoracic cavity, anchoring the lungs and separating them from the rest of the chest wall. The pleural cavity is the space between the visceral and parietal pleurae. It acts as a buffer zone to allow lung expansion and contraction. The pleural cavity contains a thin film of pleural fluid, which acts as a lubricant. This fluid reduces friction, ensuring the lungs glide smoothly against the thoracic wall during inhalation and exhalation. The pleurae, pleural cavity, and pleural fluid are not just structural components, they play critical roles in the proper functioning of the respiratory system. Let's explore their 3 primary functions. First, the pleurae and pleural fluid reduce friction between the lungs and the thoracic cavity during each breath. As the lungs expand with inhalation, this lubrication ensures smooth, effortless movement. Second, the pleural cavity helps the lungs expand. The pleural pressure is lower than the air pressure inside the lungs, creating a vacuum effect that aids in the expansion of the lungs during inhalation. Finally, the pleurae act as a protective barrier. By separating the lungs from other structures in the thoracic cavity, they prevent the spread of infection from one organ or body system to another. The tracheobronchial tree is like a highway system for air, branching into smaller and more numerous passages to ensure every part of the lung gets the oxygen it needs. Let's take a closer look. The tracheobronchial tree starts with the trachea, which divides into primary bronchi, then secondary bronchi, and eventually into tertiary bronchi. Each division becomes smaller and more plentiful as it progresses. The tertiary bronchi are especially important because they direct air to specific parts of the lungs. Each tertiary bronchus supplies a lobe of the lung with air, ensuring oxygen reaches even the smallest airways. The journey of air doesn't stop at the tertiary bronchi. It continues into smaller structures that play a crucial role in gas exchange. Let's explore this pathway in detail. The tertiary bronchi branch into smaller passages known as bronchioles, which then divide further into terminal bronchioles. The terminal bronchioles lead to thin-walled sacs called alveoli, which are the primary sites for gas exchange. Did you know that each lung contains approximately 150 million alveoli, for a total of 300 million alveoli? The alveoli are supported by respiratory membranes, which allow oxygen to pass into the blood and carbon dioxide to be expelled. Each alveolus contains surfactant, a special substance that prevents the alveoli from collapsing by reducing surface tension. Breathing is something we often take for granted, but it's an incredible process involving precise movements and mechanics. Let's dive into how this works. In a healthy adult, the respiratory rate is about 10 to 15 breaths per minute. During inhalation, the diaphragm moves downward, and the muscles between the ribs move upward and outward. This action enlarges the thoracic cavity, reducing the pressure in the airways. To equalize this pressure, the alveoli inflate, drawing in air. Exhalation is the reverse process. The muscles relax. The thoracic cavity reduces in size, and air is forced out of the alveoli. Let's break down some key terms in respiratory terminology by focusing on their common parts. This helps us understand their meanings more easily. The terms we're examining share 2 important parts: spur and ation. Spur means to breathe. Ation refers to a process. When combined, they describe the process of breathing, a core concept in understanding respiratory function. Let's discuss the disorders of the respiratory system. Let's explore some common terms and conditions related to the upper respiratory system, along with their causes, symptoms, and treatments. ORI stands for upper respiratory infection, which is one of the most common illnesses worldwide. How are these infections spread? By coughing or sneezing, which allows the virus to travel from person to person. Another name for coryza is rhinitis. It's usually caused by a virus. Allergic rhinitis, on the other hand, is caused by allergens. Major signs include swelling of mucosa in the upper respiratory passages and a clear, watery nasal discharge. Sinusitis is an infection of the sinuses, which often follows a cold. How is it treated? With antibiotic therapy to fight the infection. A deviated nasal septum occurs when the septum is pushed to one side, obstructing airflow in one nostril. What's a more common name for epistaxis? You guessed it, a nosebleed. Let's delve into some common conditions affecting the pharynx and related structures, exploring their causes, symptoms, and treatments. Snoring happens when the structures of the pharynx, such as the tongue, uvula, and soft palate, obstruct airflow. This obstruction causes these structures to vibrate and produce the characteristic snoring sounds. OSA is a condition where there is a cessation of breathing during sleep. This can lead to hypoxia, or low blood oxygen levels, which impacts overall health. Pharyngitis is the inflammation of the pharynx, often due to a viral infection. Symptoms might include a sore throat or difficulty swallowing. Tonsillitis is an inflammation of the tonsils, which can be caused by either viruses or bacterial infections. This rare form of cancer affects the nasopharynx and is typically treated with radiation and chemotherapy. In this segment, we'll explore some conditions affecting the larynx, their causes, symptoms, and treatments. Laryngitis is a condition that causes hoarseness and may even progress to a temporary loss of voice. This condition is often caused by the Haemophilus influenzae type B bacteria, particularly in children. Epiglottitis can lead to a dangerous obstruction of the airway. Fortunately, there is a Hib vaccine available to prevent this serious condition. Croup refers to a group of viral illnesses that cause a distinctive bark-like cough, often affecting young children. These are benign growths found in the larynx. They are usually treated through surgical removal to restore normal voice function. This type of cancer is frequently associated with long-term tobacco use. Early detection and treatment are key to managing this condition effectively. Now, let's dive into some essential root elements in medical terminology. Mastering these will help you understand and build more complex terms. Muck. The root muck refers to mucus, the slippery discharge that lines and protects various passages in the body. Purule. The root purule means pus, a discharge that is often a sign of infection. Nas. The root nas pertains to the nose, a crucial structure in the respiratory system. Rin. Similarly, the root rin also means nose and is commonly used in terms related to nasal conditions. What do they have in common? Muck and purule both refer to discharges, while nas and rin both pertain to the nose. Let's explore some essential terms related to voice and airway conditions. These are important concepts to recognize and understand in clinical contexts. Aphonia. Aphonia means the complete loss of voice. This can occur due to conditions like severe laryngitis or vocal cord damage. Croup. Croup refers to a barking cough often seen in children with upper airway infections. This characteristic cough is due to inflammation and narrowing of the airways. Stridor. Stridor is a high-pitched sound heard when there's an obstruction in the larynx or trachea. It's a key sign of respiratory distress and requires immediate attention. For example, a child presenting with a barking cough and stridor may be diagnosed with croup. In contrast, a patient with aphonia might need an evaluation of their vocal cords and possible treatment for laryngeal issues. Let's dive into some common respiratory functions and symptoms. These are crucial for understanding how the respiratory system reacts to irritants and low oxygen levels. Coughing serves an essential purpose. It helps to clear irritants from the lower respiratory tract, keeping your airways open and free for proper breathing. On the other hand, sneezing clears the upper respiratory tract of irritants, such as dust or allergens, ensuring clean airflow through the nasal passages. What's another name for dyspnea? It's often called shortness of breath, or simply abbreviated as SOB. This symptom is a common indicator of respiratory distress. Cyanosis is a blue-gray discoloration that appears in areas like the lips, whites of the eyes, mucous membranes, and nail beds. It's a sign that blood oxygen levels are dangerously low. For example, cyanosis in a patient might indicate a need for immediate oxygen support. Similarly, persistent coughing or sneezing could signify underlying irritation or infection in the respiratory system. In this section, we're focusing on terms that share the common root, ni. This root directly relates to breathing. Bradypnea refers to slow breathing. It's often observed in conditions where the respiratory rate decreases below the normal range. Dyspnea means difficulty breathing. This could be due to a variety of causes, such as asthma, pneumonia, or even anxiety. Eupnea describes normal breathing. It's the effortless and steady rhythm that occurs when the respiratory system is functioning well. Hyperpnea refers to deep, rapid breathing. This is commonly seen during physical exertion or as a response to low oxygen levels. Tachypnea is characterized by rapid breathing. It often occurs in response to fever, anxiety, or respiratory infections. Understanding these terms is essential for recognizing and describing respiratory patterns in patients. For example, bradypnea might indicate respiratory depression. Tachypnea could signal an early response to an infection or hypoxia. The respiratory system can be affected by a variety of conditions that impact airflow and lung function. Let's review some key respiratory disorders and their characteristics. Acute bronchitis is caused by a viral or bacterial infection that leads to excess mucus production, obstructing airflow. Chronic bronchitis involves long-term airflow obstruction, often due to cigarette smoking or repeated episodes of acute bronchitis. Bronchiolitis is the inflammation of the smallest airways, the bronchioles, often caused by inhaled pollutants like secondhand smoke. This condition can be particularly severe in children, as their bronchioles are very small. Pulmonary emphysema results in enlarged airways, leading to a characteristic barrel chest appearance. COPD, or chronic obstructive pulmonary disease, is a progressive condition that combines the symptoms of chronic bronchitis and emphysema. Bronchiectasis, often caused by repeated infections, is an abnormal dilatation of the bronchioles. Bronchial asthma is marked by acute episodes of bronchial obstruction caused by bronchoconstriction and inflammatory swelling of the bronchial lining. The most well-known symptom of asthma is wheezing, especially during exhalation. Cystic fibrosis is an inherited condition where bronchial secretions become thick, obstructing the airways. This condition emphasizes the importance of understanding viscosity, which refers to the thickness of a fluid. Pulmonary edema is the collection of fluid in lung tissues and alveoli, interfering with gas exchange. Pneumonia is an acute infection of the lungs. Viral pneumonia affects the lung parenchyma, while bacterial pneumonia infects the alveoli. Lobar pneumonia is confined to a single lobe, whereas bronchopneumonia spreads from the bronchioles to the alveoli. Pleurisy is a painful inflammation of the pleurae, often accompanied by fluid buildup in the pleural space, called pleural effusion. Why does pleurisy occur? It's often a complication of pneumonia. A lung abscess may result from bacterial pneumonia or cancer. Treatment includes antibiotics and, in some cases, surgery. Pneumothorax refers to the entry of air into the pleural cavity, often caused by trauma. This condition can collapse the lung, requiring urgent intervention. A thromboembolism occurs when a blood clot lodges in a branch of the pulmonary artery, cutting off blood supply to part of the lung. Major symptoms include chest pain, dyspnea, tachypnea, and hypoxia. Acute respiratory distress syndrome, or ARDS, is a sudden and life-threatening lung failure where fluid fills the alveoli, causing them to collapse and halting gas exchange. Neonatal respiratory distress syndrome, or NRDS, is seen in premature babies whose lungs are not fully mature, often requiring specialized care. Acute respiratory failure occurs when tissue oxygenation or carbon dioxide elimination is so impaired that vital organ function is compromised. Let's explore some conditions that can severely impact lung function and require immediate medical attention. Atelectasis occurs when part or all of a lung collapses. It's often caused by bronchial obstruction, which prevents proper airflow into the affected lung area. Hemothorax refers to the presence of blood in the pleural cavity. This condition happens when blood collects as part of a pleural effusion, impairing lung expansion. Pneumothorax is the entry of air into the pleural cavity. It can occur spontaneously with no clear cause or result from trauma, such as a fractured rib, stab wound, or gunshot wound. This condition disrupts the lung's ability to expand and requires urgent medical intervention. In this section, we'll discuss chronic lung infections. All of these terms share a common suffix, osis, meaning condition, and they highlight the impact of inhaled particles or unknown causes on lung health. This is a general term for chronic lung infections caused by inhaling irritant dust or droplets. These particles damage the lungs over time, leading to a persistent and often debilitating condition. Asbestosis results from inhaling asbestos particles, a material once widely used in construction. Over time, it can lead to mesothelioma, a deadly cancer of the pleura surrounding the lungs. Silicosis is caused by inhaling silica particles, often from industries like mining, sandblasting, or construction work. It's a preventable but serious condition that highlights the importance of workplace safety. Anthracosis, also known as black lung disease. This condition is from inhaling coal particles. It's commonly associated with coal miners and those working in environments with heavy coal dust exposure. Sarcoidosis is an idiopathic condition, meaning its cause is unknown. It results in fibrotic lung disease and can affect other organs, making it a complex condition to manage. Let's discuss the procedures and pharmacology of the respiratory system. In this section, we'll review the key tools used to assess respiratory health and function. A spirometer measures the volume of air moving in and out of the respiratory system. It's a fundamental tool used in pulmonary function tests to evaluate lung capacity and airflow. The peak flow meter measures the greatest flow of air that can be sustained during forced expiration in 1 second, also known as FEV1. This tool is especially helpful for monitoring conditions like asthma. Arterial blood gases, or ABGs, measure the levels of oxygen and carbon dioxide in arterial blood. These levels provide important indicators of respiratory function and the body's ability to maintain proper gas exchange. In this segment, we'll explore 2 important terms related to listening to body sounds during a respiratory exam. Auscultation is the act of listening to body sounds using a stethoscope. It's a critical diagnostic tool, especially in assessing lung and heart function. A rhonchus refers to a wheezing sound heard during auscultation of the lungs. These sounds occur when air passes through a constricted airway and can be indicative of conditions like asthma or bronchitis. Here we discuss auscultation and the various respiratory sounds you might encounter during a clinical assessment. Auscultation refers to listening to body sounds using a stethoscope. This technique is essential for assessing respiratory, cardiac, and other bodily functions. A rhonchus is a wheezing sound heard during auscultation of the lungs. These sounds occur when air passes through a constricted airway, often seen in conditions like asthma or chronic bronchitis. Crackles are popping sounds attributed to the opening of airways or the movement of air through secretions in the larger airways. They are typically associated with fluid in the lungs, as seen in pneumonia or heart failure. Pleural rub is a grating or creaking sound caused by inflammation of the pleurae, the membrane surrounding the lungs. It often accompanies pleurisy or other inflammatory conditions. Stridor is a high-pitched musical sound associated with constriction in the upper respiratory tract. It is often a sign of a serious airway obstruction, such as in croup or epiglottitis. Let's explore root elements that are fundamental to forming medical terms related to the respiratory system. Pulmon is the root element that means lung. It forms the basis for several terms related to lung health and function. Here are examples with words with roots of pulmon. Pulmonary, pertaining to the lungs. Pulmonology, the study of lung health and diseases. Pulmonologist, a specialist in lung and respiratory disorders. Spur is the root element that means to breathe. It's commonly used in terms describing breathing and respiratory measurement. Here are examples with words with roots of spur. Spirometer, an instrument used to measure the volume of air inspired and expired by the lungs. Spirometry, the process of measuring lung function using a spirometer. Here, we have important diagnostic procedures related to the respiratory system. These procedures help visualize, assess, and treat various conditions affecting the lungs and surrounding structures. Chest X-ray is a radiograph image of the chest. It's commonly used to detect abnormalities such as infections, tumors, or fluid in the lungs. Bronchoscopy is a procedure used to visualize the bronchi. It allows doctors to take tissue biopsies or wash the bronchi to remove or obtain secretions. Mediastinoscopy is used to stage lung cancer or diagnose masses in the mediastinum. A scope is inserted through the sternal notch for visualization. Tracheal aspiration involves using a soft catheter to remove cells and secretions from the trachea and main bronchi. It's helpful in diagnosing infections or clearing blockages. Thoracentesis is where a needle is inserted through an intercostal space to remove fluid from the pleural cavity. This procedure is often used to relieve symptoms of pleural effusion or to diagnose its cause. Thoracotomy is a surgical procedure used to obtain a tissue biopsy from the lung, pleura, or mediastinum. It provides a definitive diagnosis when imaging alone is not sufficient. Here we discuss treatments and procedures for respiratory disorders. These approaches aim to improve breathing, manage symptoms, and enhance the quality of life for patients. Rhinoplasty is a surgical procedure to alter the size and slash or shape of the nose. It may be done for cosmetic reasons or to improve breathing. Cautery is performed with silver nitrate or electrical cautery. This procedure is used to treat bleeding, often in cases of severe nosebleeds. Pulmonary rehabilitation involves a comprehensive program including education about managing respiratory disorders, breathing exercises and retraining, strength-building exercises for upper and lower extremities, psychosocial support to address emotional challenges. Nutritional support is where patients with respiratory disorders who have lost significant weight or experience difficulty breathing or dyspnea may receive nutritional support to improve overall health and energy. Immunizations or vaccinations are available to protect against respiratory infections such as influenza and pneumonia. These are especially important for individuals with chronic respiratory conditions. Postural drainage therapy is a technique uses gravity to promote the drainage of secretions from specific lung segments. The patient is positioned and tilted to facilitate the clearing of mucus. Continuous positive airway pressure, or CPAP therapy, applies constant pressure to airways through a mask or nosepiece. It provides one consistent pressure during both inhalation and exhalation and is commonly used to treat obstructive sleep apnea. Let's explore key procedures and surgeries used to manage severe respiratory conditions. These treatments can support breathing and address specific lung diseases or airway obstructions. Bilevel positive airway pressure, or BiPAP therapy, delivers two different pressures, one for inhalation and one for exhalation. This method is particularly effective for treating obstructive sleep apnea. Mechanical ventilation is used in conjunction with a tracheostomy. Mechanical ventilation provides artificial breathing support for patients who cannot breathe on their own. Endotracheal intubation is a procedure involves placing a tube into the trachea to maintain an open airway. It is commonly used in unconscious patients. A tracheotomy is an incision made into the trachea to insert a temporary airway, called a tracheostomy. It is used in patients with airway obstruction or paralysis to ensure adequate airflow. Pulmonary resection is the surgical removal of lung tissue to treat disease or injury. Wedge resection is a procedure to remove a small, localized area of diseased lung tissue. Segmentectomy involves removing a segment of lung tissue connected to a bronchus. A lobectomy is the removal of an entire lobe of the lung, often to treat cancer or severe infection. A pneumonectomy is the surgical removal of an entire lung. This is usually performed for conditions such as lung cancer when other treatments are not effective. Let's dive into the various treatments and medications used in respiratory care. These therapies are essential in managing conditions like asthma, COPD, and respiratory infections. Oxygen, delivered via nasal cannula or mask, is commonly used in hypoxia to increase blood oxygen levels. It's especially vital for patients with severe conditions like COPD. Aerosol therapy involves breathing in a mist to deliver medication directly to the airway. This approach is effective in conditions like asthma or bronchitis. Available as nasal sprays or oral medications, decongestants work by producing local vasoconstriction to relieve nasal congestion. Leukotriene receptor antagonists reduce airway swelling and mucus production, particularly in cases triggered by allergies. Glucocorticosteroids in forms of inhalants are used to decrease swelling and inflammation in the nasal passages caused by allergies. Bronchodilators relax the smooth muscles of the bronchioles, making it easier to breathe. They're crucial in managing conditions like asthma and COPD. Expectorants help by increasing hydration of bronchial secretions, which soothes the respiratory tract and makes mucus easier to clear. Mucolytics are used to break up thick mucus, allowing it to be expelled more easily from the airways. Antibiotics are used when bacterial infections are present to fight off harmful pathogens. Abbreviations are a critical part of medical terminology, especially in respiratory care. Let's go over some of the most common ones you'll encounter and their meanings. Continuous positive airway pressure, or CPAP, is a method of ventilation often used in patients with obstructive sleep apnea or chronic obstructive pulmonary disease. It keeps the airways open by delivering constant air pressure. Computed tomography, or CT scans, are advanced imaging tools used to diagnose lung disorders. They provide detailed cross-sectional views of the lungs. Chest X-ray, or CXR, are a standard diagnostic tool to evaluate the lungs and surrounding structures. Postural drainage therapy, or PDT, employs gravity and percussion techniques to promote the drainage of secretions from the lungs. It's often used in patients with excessive mucus buildup. Positive end expiratory pressure, or PEEP, is a ventilation strategy to prevent lung collapse in conditions like neonatal respiratory distress syndrome, or NRDS, and acute respiratory distress syndrome, or ARDS. Medical abbreviations are a key part of understanding and communicating in healthcare. Let's go over some common abbreviations related to respiratory and general patient care. Arterial blood gases, or ABG, refers to a test that measures the levels of oxygen, carbon dioxide, and pH in the blood. It's crucial for assessing a patient's respiratory and metabolic function. Blood pressure, or BP, is a vital sign that indicates the force of blood against the walls of the arteries. It's a critical measure for monitoring overall health. Chronic obstructive pulmonary disease, or COPD, is a group of progressive lung diseases, including emphysema and chronic bronchitis, that make breathing difficult. Carbon dioxide, or CO2, is the waste gas expelled during exhalation. Monitoring its levels can help diagnose and manage respiratory conditions. Oxygen, or O2, is essential for cellular function and life. Its levels are closely monitored in patients with respiratory challenges. Temperature, pulse, respiration, or TPR are the basic vital signs recorded during routine patient assessments to monitor their health status.